Greetings, ladies and gentlemen. Welcome to tonight's town hall meeting with our panelists, Revere Mayor Brian M. Arrigo and Dr. Nathalee Kong, Chair of the Revere Board of Health. The purpose of tonight's meeting is to create a dialogue where concerned residents can ask questions to Mayor Arrigo and to Dr. Kong about Revere's response to the COVID-19 pandemic. In a moment, we will hear opening remarks from Mayor Arrigo and Dr. Kong. First, an outline and guidelines for tonight's meeting. This is a question and answer dialogue among the mayor, Dr. Kong, and the public. To minimize technical difficulties, residents participating in the meeting are invited to type their questions in the chat function you can see at the bottom of your screen. You may also submit your questions by email to covid19@revere.org. That's COVID19@revere.org. Please try and be concise. Questions will be reviewed and relayed to Mayor Arrigo and Dr. Kong. When several questions address similar topics, we will summarize the questions and present that to our panelists as one question. We will do our best to address as many questions as time allows. In some cases, a questioner may be invited to ask the question live. If you wish to ask a live question, we ask that you indicate that in the chat box and tell us your name and the section of Revere where you live. Please get directly to your question so that we can get the most out of the time we have this evening. Please, questions must be restricted to your concerns about COVID-19 and actions that the city and the medical community are taking to protect the community's health and safety. Everyone participating in this town hall meeting is working remotely, so please be patient with the technology and with each other. If you have questions about the meeting or are concerned about technical difficulties, please indicate that in the chat section and we will try and address your issue. If you are having problems with Zoom, you can also participate in this meeting through Facebook at the city's Facebook page, City of Revere-311. Now we will begin tonight's meeting with opening remarks from Mayor Brian M. Arrigo and Dr. Nathalee Kong. Mayor Arrigo will go first.
Thank you, Bob. Good evening, everyone. We're coming to you live from the mayor's office this evening, and it's a little odd to be having this virtual town hall, but given the circumstances, this is the best way for us to communicate with everyone. I want to start off by saying that my job as mayor is to protect our residents, our first responders, and our healthcare workers, the folks who are on the front line of this global pandemic. And it's to make sure that we continue to have a high level of services to our residents, and that we make sure that we have the plans in place and that we can execute the plans that we have to support the individuals that are impacted by this pandemic. And so sharing information and getting information out as early and as often as possible is critical as we go through this health crisis together. And I want all of you to know that we are going through this together. I know this is an incredibly difficult time for all of us, and I am so lucky, and we are all so lucky to have so many great people working on behalf of the residents of the city. And we've been sharing information each and every day through revere.org, through Revere TV, through social media, through conventional media, and through text and email. And so we hope that in sharing this information, that it does save lives, and that it does make sure that people get the message. And the message is clear: to please, please, please stay home. I also want to make sure that we are accessible and available, even though we can't be more than or closer than 6 feet from each other, and that we're asking people to stay home. And that's why we're having this virtual town hall this evening. And so we want to hear from all of you in real time and get live feedback. And you can make sure that we're giving you the best information that we can. Before I turn it over to Dr. Kong, who's going to talk a little bit about the medical aspects of COVID-19, I want people to know, if there's one thing that you take away from this evening's town hall, and one message that I'm giving to everybody is to please stay home. Please stay home. And if you have to go out, please limit your interactions to those that are closest to you, like immediate family members. I know that you've all been reading and hearing about the surge that is coming when it comes to COVID-19, and the fact that there are concerns about our healthcare system not being able to prepare for that surge. And the best thing that we can do at this point, the most important thing that we can do, are our individual actions, but they're not just about us as individuals. It's about what we can do collectively to make sure that our frontline workers, that our public safety folks, and that our seniors and most vulnerable residents can be safe. And so staying home is the only way that we are going to slow the spread of this virus and ultimately minimize the loss of life as much as we can. With that, I want to turn it over to Dr. Kong. I will introduce her a little bit and say that Dr. Kong is the chair of the Board of Health for the City of Revere. She has been an invaluable resource to the city during this very difficult time. I can't imagine going through what we've kind of been through for the last month without somebody like Dr. Kong, and our reliance on her medical expertise has been tremendous. And I want to thank her for all that she's done on behalf of the residents of the city. Her work over the last month has absolutely saved lives. And with that, I will turn it over to Dr. Kong.
Thank you, Mayor Arrigo, and thank you everyone who is currently tuning in. I am very honored to be here, and I'm very honored and more than happy to provide for the residents of Revere. I also work as a primary care doctor at 3MGH right on Ocean Avenue, so this community is very much near and dear to my heart. So it's absolutely been an honor and privilege to do whatever I can to help the community. With that said, I have a lot of things I want to touch upon, so I'm just going to jump into it. Some talking points I prepared to kind of educate on the virus. First off, what is COVID-19? COVID-19 is the illness caused by a new type of coronavirus that we started to see back in December of 2019 in Wuhan, China, that has since spread globally. That coronavirus has been named SARS-CoV-2, and currently that is what's causing all this great difficulty among our community and our world. How does the virus SARS-CoV-2 spread? This virus is felt to be highly contagious, and it spreads through respiratory droplets. So coughing, sneezing, and nasal secretions from runny noses all count. It can also be spread by touching infected surfaces and then touching your face. These respiratory droplets need to enter our bodies through a mucous membrane, like your eyes, nose, and your mouth. So that's where all the recommendations to not touch your face are coming through. Who is at risk? Everyone is at risk of getting the virus, which means everyone has a role to play in protecting themselves, their families, and their community at large to limit the spread of this virus. Having said that, if you are younger and you contract the virus, odds are you're going to have very mild symptoms, maybe a little cough, a little runny nose, and odds are you're going to be able to fully recover at home. You won't need to be hospitalized or anything. However, if you are greater than 65 years old, or if you have chronic medical conditions like diabetes, like heart disease, lung disease, especially if you're on oxygen for your lung disease, if you have any of those things, you're more likely to suffer severe complications from the virus. These complications include pneumonia and severe respiratory distress, and you might need inpatient or ICU level care. Another special population are folks who are immunocompromised or immunosuppressed in any in any way, those folks are also, regardless of age, at high risk of getting severe complications if they do ever get the coronavirus or SARS-CoV-2. Want to take a minute to put that all into perspective. This is a scary virus, it's a scary time, but it's also important to know that 80% of those who are infected, according to data from Italy and China, they do not require hospitalization. They are able to get better on their own at home. What can we do to stay protected? To take a page out of the mayor's book, stay at home. All right, stay at home at all costs. Now is the time to be limiting all non-essential trips outside, all non-essential businesses, anything of the like. Try your best to stay at home. If you need to go outside, you need to go get gas or buy groceries, practice social distancing. What I mean by that is please stay at least 6 feet away from other people that you may or may not encounter if you have to go outside. Why 6 feet? Because respiratory droplets, those ones I mentioned before that spread the virus, they have a low likelihood of traveling more than 6 feet. So if you are going to be outside, keep your distance. Avoid touching your face. All right, remember, those respiratory droplets need to enter through some sort of mucous membrane, so don't touch your eyes, nose, or mouth if possible. Practice hand hygiene using warm water and soap for at least 20 seconds. This will get the virus off your hands so that when you do touch your face, because I know it's hard to avoid that, you won't accidentally infect yourself, all right? The other important thing to know is that if you don't feel well, please stay at home. Please contact your supervisor, your manager, your boss. Stay at home so that we limit the spread of this virus, and call your PCP for further guidance. I want to fight this virus is to avoid getting in the first place. There are no spectators in the fight against COVID-19. We all have a role to play. So whether that's simply washing your hands, or whether that's being the voice of reason amongst your friendship circle and saying, hey, I don't think we should go outside. That's not a good idea. I don't think we should hang out. Or whether that's having the courage to notify your manager and let them know you're sick and to stay home when you're sick. These are all small ways that we can contribute every day that will add up to a big impact when it comes to fighting and winning against COVID-19. With that and with time in mind, I'll end there. Back to you, Mayor.
Thank you, Dr. Kong. Before we get into questions, I do want to just acknowledge that we have been working as a city for the last month in an emergency capacity, and it's been a real team effort, and we've put together an emergency response team, and I want to thank all the folks that have gone above and beyond over the last month as this virus has kind of come to us, and as we've been dealing with it. And in our kind of work as an emergency response team, we've had really two key priorities. One is making sure that we're taking the proactive steps to slow community transmission in the city of Revere, and then also preparing ourselves for the further spread of the virus. And so with those kind of two priorities, we've had three main focus areas. One, our most vulnerable populations, our children, our families, our seniors, our veterans, and those who have substance use issues, and our homeless population. We've made sure that another area of key focus is our first responders, and making sure that they're safe and they're protected and that they have the resources that they need. And third is making sure that we're sharing credible information and resources as frequently as possible. And that's why we've been pushing out information in all different forms, including this virtual town hall tonight, and making sure that that information is credible so that there aren't rumors that are spreading throughout the community. So where are we today? As we speak tonight, we have 166 positive cases in the city of Revere. And that's a high number. If you look at some of and we've been tracking the data as over the last month, and seeing the number of new cases each day, and looking at some of our surrounding communities, we are higher than those other communities. And that's why we've been really aggressive with our approach, talking to the community, making sure that people understand that they need to stay home. Because it's clear that that message hasn't necessarily gotten through, because we are really a hotbed of activity in the Commonwealth. And so that's why it's so important. That's why we're doing things like this town hall this evening, to make sure that people understand the seriousness of this virus, and that we are being impacted. There are 166 cases of COVID-19 in the city of Revere. And we want to make sure that people know that they need to stay home. And that's the only way that we are going to stop the spread of this virus. With that, I guess I'll open it up to questions and open it up to the moderator to start asking them.
Okay, Mr. Mayor and Dr. Kong, we have several questions. And in fact, there's a number of questions that focus on the situation at the Jack Satter House. I'll summarize those questions. They come from both residents of the Satter House and of people who are concerned about the Satter House. One question generally involves why is the concern about the Satter House as opposed to other residents, other dwellings where multiple elderly residents live. And the question of whether or not the circumstances at the Satter House are implemented in other nursing homes and other elderly housing residences, and if so, why, and if not, why not?
Okay, I'll take that question. I want to start off by saying that the folks at the Satter House, my heart goes out to everyone that is quarantined, everyone that is fighting this virus, and everyone and their families who have succumbed to COVID-19. We have had 5 individuals pass away from the Satter House due to COVID-19. And that is part of the reason why there is so much attention, obviously, given to that building. And I will say this, that a month ago, when we knew that COVID-19 was coming, and we were in our plans to prepare for what was coming, I had conversations with leadership in all of the nursing homes and independent living facilities and in our housing authority to make sure that folks understood that we were preparing, that we would, and we wanted to hear their plans for preparing. And I do have the utmost confidence and respect in the folks at the Jack Satter House who have been able to step up during this incredibly difficult time. With that said, the city did order through the Board of Health that the residents in the Jack Satter House would quarantine, would have to remain in their individual units to prevent further spread of the virus in that building. And when we did that, we also put out an advisory, and that was an order that everyone had to stay in their units. We put an advisory out to the rest of any multi-unit buildings, especially ones with seniors in them. We made sure that they understood the guidelines that we were giving to the Jack Satter, and we asked them as an advisory to be thinking about implementing some of these measures, and those included things like limiting the congregating of more than 10 people, limiting interactions with individuals, and really trying to ask that people stay in their units. So we have had communication with all of those buildings. We've had communication with our housing authority. I'm in daily communication with the folks at the Satter House to make sure that we can support them. And I do want to, again, thank Dr. Kong. Through her work and through her connections, she's actually been able to provide additional testing that's happening at the Satter House now, so that we can get ahead of any folks that may end up coming down with symptoms. So I want to thank Dr. Kong for that help. And the Satter House is still a concern for us. We want to make sure that we're interacting and we're getting updates but I have the utmost confidence in the folks there. And the other thing that I'll say is that we have put in place a terrific team, an outreach team from the city to help folks, and they're doing daily wellness calls. They're providing a delivery of food to residents, to seniors, and on a bigger scale for our seniors, we want to make sure that they know that we are here to support them, and that they, if there are any issues, we want to hear them. So.
This next question, Dr. Kong, did you want to add anything to that?
No, he basically said it all. I think the Jack Satter House, it's getting a lot of attention because they have a cluster of cases there right now, and we sure to act swiftly and to be most strict with that house in particular. Had more of a reason to, but having said that, we made sure that whatever it is we mandated the Jack Satter House to do, we sent out advisories to all other similar living facilities in hope of putting in place these strict guidelines, rules about congregation, about quarantine, self-isolation, etc. And we're hoping that will stem the spread of the virus into those vulnerable populations that way.
This is a question from a gentleman by the name of Dave regarding the actual meaning of stay at home. His question is, does stay at home mean that residents that are not showing symptoms cannot or should not go outside for walking or jogging to get exercise and things of that nature?
That one?
Sure.
All right. So the terminology can be confusing. Stay at home applies to patients who are not positive for coronavirus, and it applies to patients who don't have symptoms. All right. So if you're otherwise feeling, you stay at home advisory, by the mayor and by the governor of Massachusetts, and that means you should limit your movements outside your home as much as possible. Having said that, it can be really easy to get cooped up in your own four walls. So you get some fresh air. It's a really stressful time. Getting some air probably going to be good for your health, to be honest. And that's okay if you're asymptomatic, if you're totally fine. Again, when you're outside, practice social distancing. Try to be 6 feet at least away from the next person. Cross the street if you have to, walk a little bit slower, walk a little bit faster, but just put some distance between you and the next person if possible. If you have symptoms, you should obviously contact your PCP, and they will 9 times out of 10 advise you to self-quarantine, which means you got to stay in because you're coughing, you're sneezing, those respiratory droplets are coming out of you, and you could somebody. And then obviously, if you have COVID-19, you need to have strict isolation. I hope that's.
Thank you, Doctor.
Clarified.
This question probably follows along the same lines. It's asked by a gentleman named Mike. What is the city doing or planning to do about large groups who are organized in participating in recreational activities? And he specifically mentions running or jogging groups. It apparently would apply as well to group sports such as basketball and so forth.
Yeah, sure. So in terms of basketball, today, thanks to the great work of our DPW, we have actually zip tied all the basketball rims at our playgrounds, and we've been able to hopefully discourage anyone from trying to play some basketball. We did have some folks who were playing basketball up in North Revere, and we wanted to be on top of that and make sure that that's not happening. In terms of any large groups, what we're asking folks to do is to just to be mindful, and if they're seeing that, please let us know. We've got directives out to our public safety folks that if they do see groups congregating, to make sure that they're breaking them up. The largest place that we've seen that in the city has been on the beach, and we've made sure that the concerns that I have around the beach, which are many, I've communicated those to the governor, to the state delegation. As many people know, the state, the Revere Beach Reservation is owned and operated by the Department of Conservation and Recreation, the state's DCR office. And so we've conveyed the concerns. We've actually had conversations with all the business owners down there, the restaurant industry down there, and they've been more than willing to, and they've been understandable about the situation, especially Kelly's. I want to thank them, thank the management down there for their support, because they understand that people congregating at their restaurant really isn't in the best interest of public health, and they've been willing to change their operation a little bit. But we have had conversations about what a further kind of shutdown of the beach would look like, and we expect those conversations to continue. And I'm making the case that for that first day, that's 70 degrees, anybody who's lived in the city ever knows that that day can be a little bit of mayhem, and that's without social distancing and without COVID-19. So we want to be prepared and ready for that nice weather, and we will be. And we're working with our partners at the state level to make sure that we're on top of that.
Thank you, Mr. Mayor. If you would just continue along that line, because there have been a number of questions specifically about the beach, and that is what plans are in place or will be in place to control crowds at the beach as the weather gets better.
Yeah, so like I said, we've been in constant communication. I've been in communication with the governor, with the Secretary of Environmental Affairs, to make sure that they understand our concerns. And I know they're hearing it from mayors all over the Commonwealth who live in coastal communities about beaches. And it's not necessarily the residents of the city and the residents of the beach who enjoy the beach. It's the folks who are driving to the beach and coming and enjoying it. And what I've been telling everyone is, either come back in the summer when hopefully this passes and we're into July and August and people can enjoy the beach. Come back when the weather's a little bit nicer. And there's no better place, believe me, there's no better place in the world to enjoy a mild March or April day. But we really, and that's how the focus has been on asking people to stay home. And we will be prepared for a mild day. And as I said, we've had consistent communication with our state partners. Our state delegation understands the concerns that we have. And I'm confident that there will be action pretty soon in regards to the beach.
Thank you, Mr. Mayor. Several questions also on this topic, so I'll summarize them. And that is basically, why are construction sites in the city still operating?
Yeah, sure. So construction sites are still operating. We are following the guidelines that have been handed down by the governor around construction. And it's been made clear by the governor's legal counsel that during a state of emergency, the orders that he provides cannot be superseded by a municipality. And so we are following those orders. Those orders are that construction is deemed essential and that it will continue, but with the caveat that there would be additional guidelines given and that that we would enforce. So our Inspectional Services Division has been briefed and updated on those guidelines. We've shared those with at all of the active construction sites in the city. And we've made sure that they will have a stand down day, that they'll have an occupational kind of hazard point of contact, that they'll have a COVID-19 contact, and that they're following the guidelines that are being provided by us, to us by the state. And so our ISD folks have been out each and every day, making sure that those guidelines are being held up, and the people who are doing the construction work in the city know that if they don't follow those guidelines, their permits will be pulled. They'll they will have to stop their construction, and they will stop their work, and they'll stop their work indefinitely. So that has been that message has been conveyed. I do ask that the residents, if you see something, because I can't have eyes and ears everywhere, and I know my inspectional services division is limited in their staff capacity. If you see something, please let us know, and we will be on top of it, and we will shut a site down if they're not practicing social distancing, and if they're not doing what they're supposed to do. We have the ability to do that, and so I want to make sure that residents know that we want to have you be our eyes and ears, and we want to hear from you. And if you see folks doing anything that isn't proper, please let us know.
Thank you, Mr. Mayor. This next question comes from a woman by the name of Gina. What exactly is the city doing to support seniors at home? Are there community outreach? Is there community outreach or calls to them? Are there volunteers who can reach out via phone and check on their needs?
Yeah, it's a great question. I would start off by saying, please, if you are able to, please sign up to be a volunteer. You can sign up at revere.org. There's a coronavirus link, and you'd actually be able to sign up as a volunteer. And we do have, which is great. Over the last month, we have an army of volunteers, and that I am eternally grateful for. And we have an outreach team that has focused on our seniors and making sure that we're making wellness check calls, that we're also providing food and other necessities to our seniors. If we're asking seniors that if they have any needs, to please call us. Please call 311. We will process their request, and we'll do the best that we can. We also, in advance of that, we sent out a letter to every single senior in the city, letting them know that we are thinking about them. We're here for them. We're here to support them, and that if they need anything, to please reach out to us. And I know that our 311 folks have been amazing during this crisis, and that they've gotten a lot of phone calls. And again, I want to thank the folks on our outreach team who have been amazing. Debbie down the senior center has done an incredible job, and our volunteers who have really stepped up. So we are doing a lot, and we want to make sure that the seniors know that we are here for them, and that we're supporting them. And if they need something, that we're here to step up.
Thank you. Dr. Kong, anything to add to that?
Nope. He said it all, as usual.
Okay. This question comes from a woman by the name of Eliana. As the number of cases increase in Revere, are we going to be notified of the locations of these cases? And how will we find out where they have been?
Yeah, that's a great question. And it's one that a lot of municipalities and there has been a lot of conversation with the state and with other municipalities about information sharing. And we are limited in what we can share. And we've actually, in fact, gotten some guidance that we shouldn't even share the number of cases, the number of positive cases per day. And from my perspective, I think it's important for us to share those numbers, and we've been sharing them, and we will continue to share them daily, because it really shows what kind of impact this has had in our community. To have 166 cases in a city as small as the city of Revere is a significant impact. With that said, we are limited in the type of information that we can give out, and so I feel comfortable telling the residents the number of cases that we have. We cannot share the exact locations of these cases, and that information has to be shared with first responders, but it cannot be shared otherwise. And so we are following those guidelines around individual exact locations of cases, and we've made sure that that we try to keep our residents as informed as possible without running into any issues with the law or with HIPAA, which is the law that controls a lot of private information around health records and health information.
Thank you. Dr. Kong, anything to add to that?
No, I just want to echo that it has been challenging, the messaging we have been receiving, and I obviously agree with the mayor. I think we do need to continue to notify our residents what the total number of cases is, but it is a little bit frustrating when trying to kind of handle the other information, like where these cases are coming from. So I definitely sympathize with their frustration, whoever asked the question may feel about that, but we are limited.
And I'll say one more thing about that. One thing that we have, and this goes back to one of the questions about the Jack Satter House, we are seeing cases all over the community. There aren't necessarily one or two places where we're seeing cases. We're seeing them really throughout the community. So, and that is alarming because that tells us that there is community transmission happening in the city of Revere, and that's why it's so important to tell folks to please stay home.
There have been several questions specifically regarding testing, about people who wish to be tested, want to be tested, where can they be tested. Some of these questions relate to testing at the Satter House, and some of them are just in general. Dr. Kong, could you address the methods, the procedures, the criteria that are in place for testing?
Mm-hmm. Yeah, sure thing. So testing remains a huge frustration for me, and I think most of the medical community. Testing is very limited because we just don't have enough tests. So there are certain criteria that all patients need to meet in order to get tested, and the main one is just having symptoms. Symptoms are usually a fever or feeling feverish, like having chills, a cough, sore throat, difficulty breathing or shortness of breath, a runny nose, muscle aches, new muscle aches, or a new and sudden loss of smell and or taste. Those are the main symptoms we're asking now. And if folks exhibit those symptoms, and if they are in a high risk category of patients, kind of like the ones I mentioned earlier in the town hall, they could be referred for treatment through their primary care doctor. That's probably the main way any of us can get tested, is through your PCP. Other special populations that are also getting tested are obviously healthcare workers, since we are in contact less than 6 feet apart to patients, and we see a lot of patients. So if we have it, we could be huge vectors for spreading it to vulnerable folks in the hospital and even outside the hospital in our clinics. So obviously they need to be tested. First responders, same thing, EMS, fire, and police, they're under that kind of, high risk population of patients, in that they require kind of close contact when they are first on the scene. So they need to be tested in order to keep themselves as well as the community at large safe. We do have testing now for the Revere first responders through East Boston Neighborhood Health. So we've been able to set that up. There are a number of testing sites around the city. So CHA in Somerville has a testing site for their patients only. Again, it has to be by appointment and it has to go through your PCP. The BI has testing sites over in Boston. MGH has a number of testing sites in Boston, and the newest one that just rolled out is in in Chelsea. Again, these are all by appointment, and it's all after you meet certain criteria. It's frustrating, but the goal is that we preserve tests for those patients who are in the hospital, in the ICU, ventilated, or we reserve them for our healthcare workers and first responders who need to know if they're positive or not, who need to know if they're negative or not, so they can go back to work, because we are starting to see shortages of doctors here and there. So it's been a tough situation to go through to sort of almost ration these tests, but we're doing it for good reason. Just know that even if you test positive or negative, there is no specific treatment. So we would still advise you to try to isolate yourself at home. And symptoms, cough drops, Tylenol, only difference would be if you have severe symptoms and then you need to be treated in the hospital. So that's kind of where we're at.
Thank you, Doctor.
And if I could, I just want to say one thing, and I want to thank Dr. Kong for all of her work. She kind of glossed over the testing that we have for our first responders, but that is a huge step in the right direction for us, and to make sure that our first responders, our firefighters, and our police officers have access to testing. And Dr. Kong has played a critical role in making that happen. And I just want to thank her. East Boston Neighborhood Health Center and Suffolk Downs and the City of Boston have been great partners, but none of that would have happened as quickly. Like she said today, we had our first firefighter tested. And that's thanks to the hard work of Dr. Kong. That wouldn't have happened as quickly as it did, and it would have come together the way that it did. So I want to thank her for that.
Mayor Arrigo, you referred earlier tonight to volunteer opportunities, and there have been several questions posed about how people volunteer. So would you mind repeating that? We have a couple of people who said they're willing to work on phone trees. They have some time and they're all stuck at home, so they're happy to help out. Could you just repeat the volunteer?
Yeah, so if folks go to revere.org/coronavirus or COVID-19, and I'm not sure about the exact address, but if they go to revere.org, there is a volunteer worksheet that they can fill out. And we ask people if they have any preference in what they can do. Even if you're home, you can help. You can make phone calls and make wellness checks for some of our seniors. And really, this is all hands on deck. And anything that I know that the City of Revere and the people of the City of Revere are incredibly resilient, and they all step up and they are doers. And so I want to thank all the volunteers, all the people who are going to volunteer after hopefully watching today, and all the folks who are helping us through this public health crisis. Again, I can't stress it enough. Please stay home, and if you are able, please volunteer. We would love to have your help and help fight this virus.
Several questions have addressed the number of people that are in shopping centers and supermarkets, and generally the question is, what is being done with large stores, including supermarkets and grocery stores, to make it as safe as possible for people to shop there?
Sure. So we have worked with our business community, and we've made sure we've gotten a lot of complaints about a few places. I won't name anyone, but I will say that there were new measures put in place today in several places, mostly big box supermarkets that are essential places for people to be able to shop. We just want them to be able to shop in a way that protects public safety and public health. And so our business community has stepped up. Again, I ask residents if they're seeing anything or hearing anything to please let us know. I know our phone lines have been flooded with different tips on things that are happening, and we've been able to respond to those. And thankfully, folks like Market Basket and Stop and Shop have understood what we need to do. And so one step that we have taken, and I don't know the numbers off the top of my head, but we've limited the number of people that can go into different essential businesses like grocery stores based on the size of the space, right? So if you have a big store like Market Basket, we're limiting that. I think it's 140 people that we're limiting to, but we're limiting it to a number of people, and so that the so that the employees feel safe, so that anybody who's a customer feels safe, and that people know that we're on top of this and we're taking the right steps to make sure that the public is healthy, and that we fight the spread of this virus.
There've been a couple of questions regarding trash collection and whether or not the city is loosening any of its measures or doing anything in particular with regard to trash collection.
Yep. So I know trash collection and street sweeping. Crazy enough, is the beginning of street sweeping season, and usually our communications as a city would be all around the fact that we want people to get their cars off the road, and that street sweepers are coming, and that we don't want you to get ticketed. We have relaxed a lot of our enforcement around trash and around parking. If you notice, we do have the street sweepers are out, but we're not ticketing, we're not towing. And the same with trash. Of course, if there's a very over the top example of trash all over the place, we're gonna take some action. But in terms of people, and I know I can speak for my own household, my wife and two boys have been home for much of the last several weeks. And we are creating a lot more trash than normal. And so we have relaxed the amount of trash that's going out in terms of the blue bins. And if people want to use their overflow bins, we're encouraging that. What we don't want to see is trash, obviously all over the street. And if you're doing that, we're gonna ticket you. But if you're being responsible and using an overflow bin, we are relaxing our enforcement of that.
Along those same lines, there was a question about plastic bags. So if you want to just address that, Mayor Arrigo.
Yeah, sure. So, and I'm pretty sure that the state came down with some guidelines around the reusable bags. So we have let the business community know that we are relaxing our ban on plastic bags. I believe that some supermarkets have already started using plastic bags. We heard from some people that they were running out of paper bags with the amount of people and the amount of products that were coming off the shelves. And so we have relaxed the requirement around, or the restriction around plastic bags.
Thank you. Dr. Kong, this is one of the topics of the day. A question primarily for you, but also for the mayor. Are fabric masks effective? And if so, is there a way to volunteer to make them?
Yeah, so for first responders and for healthcare workers, we must use medical grade masks in the care of our patients. So while we are not allowed to use it, I actually do encourage, and it sounds like the federal government and CDC are starting to consider the use of things like fabric masks or even scarves or bandanas. If you're going to be going out to, say, grocery shop or put gas in your car, that's honestly, I would encourage doing that. And if possible, if there are any volunteers out there who can make the fabric masks, please sign up. Please let it be known, because we need them. If it were up to me, I would love to have everyone have a mask, a reusable, hand washable, or machine washable mask to use, because it's not going to hurt. It will not give you a pass to go out and play basketball and hang out on the beach. Don't take it that way. But I think it will encourage continued safety among kind of these respiratory droplet spread, especially when you're out and about doing the essential things you need to do, because we all can't stay home, cooped inside our homes 24 hours a day, 7 days a week until June. So yes, please make yourselves known. I want to talk to you.
And one thing I'll say about that is that we have had one community group, the Moroccan and Revere connections I'm botching the name, but Rashid Moukabir and the Moroccan community in the city of Revere has done an amazing job they've donated a number of masks to the city, and I know that we were using them actually this morning for our veteran food bank, which we were able to continue kind of providing to our veterans, and thanks to the masks that were donated by the community. So again, that's another volunteer opportunity, and we'll make sure that people know that they are safe, and that we want to promote any community organization that wants to help, or any individual that wants to help make them. We're more than ready to distribute them.
We're nearing up on the hour to the panelists. This question comes from a woman by the name of Karina. Is there any special support for families with children with disabilities?
That's a great question, and I know that as part of our outreach team, Ralph DeChico from our Commission on Disabilities has been involved, and I know that they are working and kind of getting volunteers and making sure that the needs of our any families that have anyone with any disabilities can be met. And so Ralph has done a tremendous job. He's been part of that outreach team, and I would encourage anyone who is in need of anything to please call 311. Please call the mayor's office, and we will make sure that the residents are taken care of. At the end of the day, that's like I started saying this evening, that my job is to protect the residents, make sure that people know that what we're doing, and communicating with the residents in each and every way that we can. And if there are any needs that need to be met, we're here to help meet them. So our outreach team, again, I can't say enough for the folks who are leading our outreach team. Charlie Jafrida, Dimple Rana have done an amazing job in setting up the right kind of structure to make sure that we are prepared as we see the number of cases increase.
A couple of last questions. One of them specifically refers to the CDC, and Dr. Kong, you might address this in terms of the city's relation with DPH. How closely is the city of Revere working with, they say CDC, but public, higher echelon public authorities? And are there any specific investigations going on regarding location and spread within the city of Revere?
So we are definitely working very closely with the Massachusetts Department of Public Health, and they are working with the CDC. So lots of things are coming from the top down and trickling in that fashion. Every day, Jeff Stone is on what seemingly multiple times a day is on some sort of call with the DPH, and he's constantly several times a day disseminating new information to us regarding this virus. In terms of contact tracing and kind of doing some more research into where these cases are coming from, Carol Donovan and her team of public health nurses have actually done a phenomenal job working literally day in and day out, Monday through Friday and throughout the weekend, to notify everyone who has tested positive, and to also step backwards and see, okay, who have you been in contact with, and who do we need to call to tell them to quarantine, to find out if they have symptoms. So we definitely have a lot of unsung heroes that unfortunately are not part of this conversation today, but they are doing a lot of work, working tirelessly to minimize the spread and minimize the impact of this virus on our community.
Yeah, and if I could just say one thing, I want to echo Dr. Kong's comments about the nurses, especially Carol and Adrian, and all of the nurses that work for the city have done an incredible job. They've stepped up. They've gone above and beyond their own work as school nurses, and they've just done incredible work to make sure that the spread does slow down in the city of Revere, and that they're working day and night to do that, in weekends, as you said, and they don't have to. And so I'm eternally grateful. I told them this earlier this week, that I'm eternally grateful for the work that they do and the work that they've done. None of them expected to take a nursing job in the city of Revere and fight a global pandemic, but that's what they're helping us do, and it's been amazing. And one other thing that I'll say is that I am on pretty much daily calls with either the lieutenant governor, the governor, other mayors, our state delegation, our federal delegation. The amount of communication that has been going on, even with regional partners, has been amazing. And so many of us, a lot of times an emergency happens in your city and you have to deal with it. We are right now, as a Commonwealth and as a country, going through this all together. I'm getting information from mayors from all over the country, and using some of that and bringing it to the city of Revere. So we're all in this together, and it's really been, there's a sense of camaraderie with everyone from local leaders, state leaders, and our federal delegation. So that there is constant communication in terms of what's coming down from the state and the federal government.
I'll ask one last question, and this question probably addresses what we all acknowledge is the great unknown. The questioner acknowledges that we don't really know for sure, but asks, are there any projected numbers, and how do you get this across to people to understand that the numbers will increase even faster if people don't stay home? People need to realize that the higher the number, the more deaths there will be.
So I think this might be a great opportunity for Ruben, if he's still there, to throw up a chart that we have showing the number of cases and what we've seen in new cases over the last month, or actually only over the last 2 weeks. And I don't know if Ruben's able to do that, but you can see, I mean, everyone has seen these trends of the spikes and what the, kind of flattening the curve, which was a big point of conversation or a couple of weeks ago. You can see what's happening, and we're, essentially doubling cases pretty much every 2 days. And so what we're making sure we tell people is to, and that's why we're having conversations like this today, is to stay home. I mean, if you look at these numbers, it's clear that that people in the city haven't been heeding the warnings that we've been giving, and been hearing the message that we've had to please stay home, to please socially distance, and to not congregate. And again, this is a stark chart. And if you project that out over the next 2 weeks, things could be pretty grim in the city of Revere. And that's why we want to, again, communicate and let people know that we need to stop the spread. And the only way that we're going to do that is by staying home. And I think if people understand and look at this chart and see the trajectory that we're on right now is not good. And it's worrisome. It keeps me up at night. And so it's my job to protect all of you. So please spread the word. Please tell people, like, this is really powerful information. And we hope that you take that and hopefully we can stop the spread, and we can start to see a plateau, at least on these numbers.
Dr. Kong, anything you wish to add to that?
No, I mean, I think, again, the numbers are clear. They're right there. Those are the total number of cases in the dark blue line. So we're up to 166 as of today. The new cases, I would like to see continue in that way, in that we're not seeing like 26 to 50 new cases. We're seeing 26 to 25 new cases. And hopefully we'll start to see 10 new cases, then 1 or 2 or something. I'm hoping that with all of the city's efforts in social distancing and staying home, that we will slow the spread and start to see a reduction in the number of new cases as time goes by. And I'm hoping that will give us the glimmer of hope and the second wind to keep on fighting the good fight.
And Doctor, I know we're a little bit over time here, but one person had a question that suggests a little bit of confusion. If I'm diagnosed and tested positive for the virus, who do I report to let them know?
So if you are a resident of the city of Revere, we have every lab in the state must report their numbers to the state. So we will get that. There's no one that you need to tell. Obviously, tell your primary care doctor if they already don't know, just so they're aware. But you don't need to actively do anything. We will get the numbers. Carol and her phenomenal team will get the numbers. So there shouldn't be much on your part to do. Just stay at home and try to get better.
Thank you. That brings us to a little bit over the hour that was allotted for tonight's town hall discussion. I'd like to turn it back over both to Dr. Kong and to Mayor Arrigo for any final comments.
Dr. Kong, please.
Sure. Again, thank you all for allowing me to be on a part of this town hall today, and obviously thank you for letting me be on the Board of Health and to provide any assistance that I have. This is why I became a doctor. I love seeing patients face to face, but it's been a tremendous joy to take care of patients in a different and a more unique way that is different from my usual office environment. So it's been an honor and a privilege, and I hope to continue offering whatever services I can, and hopefully not hopefully, but I know we're going to get through this together. And again, underscoring that word, we're only going to get through this together. There are no spectators in this battle right now. We're all key players on this battlefield, so just do your part.
Thank you, Dr. Kong. And I'll end by saying, as I said earlier, the city of Revere is full of very resilient people, and we are going to get through this together. We have to get through it together. And as I said, my job is to protect our residents and make sure that the city is prepared and ready for anything. And so I cannot do that alone. I have to say that we've said that there are unsung heroes all over the place, and I've named a few of them. There are so many, and too many to name, but I want to thank them for all of the work. Our police and fire departments, our DPW, our water and sewer department, everyone in the city has stepped up, and I'm proud to be the mayor of the city, and I'm proud to have so many great people working with me in this really, really difficult time. And I know that we will get through this together, and that the residents are in good hands with the people that we have. And Dr. Kong, again, I want to thank you for all the great work that you've done on behalf of the residents of the city, both in your professional capacity, but in your capacity as a chair of the Board of Health. Thank you for everything that you've done. And as I said, we will get through this together. I'll end it with two words, the most important two words that I can say over, probably the next couple of months. Stay home, please. Stay home. All right. Thank you, everyone. And thank you for joining us this evening.
Thank you, Dr. Kong, and thank you, Mayor Arrigo. That concludes tonight's live town hall meeting. To all of the people who participated from across the city, thank you very much.